How do you know if you're a bodybuilder? Well, when you chew chewing gum, you try and chew as much on the left-hand side as the right-hand side, because you don't want to have, like, slightly asymmetrical jaw muscles. Okay, no, I'm joking. Yeah, hello. Let's talk about your journey to hormone optimization, because you hear all sorts of different stories. You hear about miraculous transformations. You hear about long, drawn-out journeys. You hear from people who actually didn't feel anything from testosterone replacement therapy. So, who should you listen to? Well, I think the first thing to note is that your testosterone journey is your testosterone journey. Why is it your testosterone journey? Because it's you. It's you're an individual. You are unique. You're not special. You're unique. So your physiology, your genetics are particular to you. Your requirements are particular to you. So your journey will not be the same as somebody else's. It may have similarities, but it won't be identical. So after you've had a formal diagnosis of low testosterone, you are then subsequently reviewed by your TRT doctor, let's hope, face-to-face, let's hope. And he will assess your suitability for TRT. If he or she agrees that TRT is the best option for you, then they will design a protocol. Now, without going into the specifics, I will put a link to the Men's Health Clinic TRT management guidelines in the comment section. So it's obviously based on a whole number of factors: body habitus, propensity to aromatization, SHBG, age, etc. So it's not something that you just pick out of the hat. Well, I don't pick it out of the hat. So you are commenced on your TRT protocol. The first thing to realize is we are trying to achieve stability. So if you want to know what a stable, optimized TRT protocol feels like, you, number one, have to be stable. Now, you have to consider the testosterone ester that you're using in order to know when you are stable. So traditionally, it's testosterone enanthate here at the Men's Health Clinic, and now testosterone cypionate. And it takes about 5 half-lives for you to become stable. So that normally means about 6-7 weeks. Is it as simple as that? No, nothing's ever as simple as that. So there are compounding issues like your SHBG that will influence things, and your creatinine clearance, your kidney function will dictate how long it takes for you to become stable. Now, what does stable mean? Because when you're stable, you can feel terrible. Disappointing, I know, but you do need a baseline to work from. So you really shouldn't try and alter your TRT protocol until you have reached that stability. So normally 6-7 weeks. However, I review guys at 4 weeks. I have blood tests done because I want to predict whether they're going to have a problem when they're at 6 or 7 weeks, when they're stable. So traditionally what we do is we measure bloods in a trough, so the day of your injection, but immediately preceding it. So the rationalization for that is, as I said, obviously to predict a problem, but the commonest issue that we find is people have high estrogens, so they aromatize too much testosterone to estrogen. So if you're finding that your trough level is high at 4 weeks, at 6 weeks when you're stable, it's going to be super high. So you need to sort of predict and hopefully prevent an issue from occurring. So That's the reason why I review guys at 4 weeks and not 6 weeks when they are stable from a pharmacokinetic perspective. I'm trying to prevent a problem from occurring. If a problem arises, then there are certain ways of managing it, and that obviously includes dose alteration, injection frequency alteration, and the possible addition of other ancillary medications. Then again, you need to wait 4 to 6 weeks before you can retest their bloods and ascertain whether it's had a positive effect. And then again, so it can be a journey. Some guys walk out of the new patient consultation and almost feel an immediate improvement. Now, part of that's placebo, and there's nothing wrong with having a placebo effect. But part of that is actually in part due to the HCG. So the HCG has a really short half-life. It has a short half-life of 2 days. So people can actually feel a qualitative difference within a week. And that's because of the HCG. So HCG that mimics luteinizing hormone can stimulate the receptors in the brain, bringing about that sense of well-being. So you can actually feel pretty good pretty quick. However, you're not really going to experience the true benefits of TRT. And again, you need to understand that the true benefits of TRT are long-term physical and psychological health due to hormonal balance. Establishing hormone balance can be a pain in the butt. We are unfortunately a species that has a propensity to aromatization. So irrespective of the most effective TRT protocol, your clean lifestyle, we are exposed to plastics, BPA, etc., estrogens in the water. None of us lead that cleaner life that you can say, well, I don't really understand why I've got a problem with aromatization because I eat super clean. I'm guaranteeing you don't, unless you do grow all of your own veg, hunt your own animals, and eat seasonably. You know, it's a peculiarity. We buy avocados from Chile when they're plucked from the tree before they've had time to take the nutrients from the soil and ripen from the sun. So, you know, as healthy as you think you are, you're probably not as healthy as you really are. Or really think you are, sorry. So, what should happen? Well, what should happen is you should be starting to build up a baseline of testosterone. Now, you will obviously have peaks and troughs, and those peaks and troughs will not go away, but they'll be minimal when you're stable, because obviously when you're injecting, there will be a peak once you've injected. It's not rocket science, but those peaks and troughs should be minimal, and they should not be noticeable, which is the reason why we don't use libido. It's the reason why we don't use Testosterone. It's the reason why we use enanthate and cypionate as our gold standard here at the Men's Health Clinic. So we're trying to get stable, we're trying to minimize peaks and troughs so that you can feel the qualitative improvements of having optimal androgen levels. So yeah, you start to build up, and often guys go through this almost like honeymoon period as the testosterone rises, as the HCG takes effect. They have a return of the morning glory, which is always a good sign of an optimized TRT protocol. In fact, morning glory is my favorite sign of an optimized TRT protocol because it takes away all the garbage. So libido can be affected by numerous things such as chronic disease, tiredness, etc. So it's not a wonderful sign if your libido is still not cracking and you know you're not feeling as if you're optimized. Morning erections is my go-to. I like that. So they can go through a honeymoon period, and then sometimes as that 4-week period actually kind of comes to an end before they do the blood test, they'd have a little bit of a drop. Typically that drop is due to an estrogen spike. So it's disappointing, but it's a reality, and it does actually provide quite a useful purpose. It actually gives you an insight into how you feel when you're high. So hopefully we're not talking about super physiological testosterone levels, we're more talking about the spike in the estrogen. However, interestingly enough, I had a super young guy who came back with a testosterone level of 98 after 4 weeks. 98! Oh my God. He had it repeated. 98! My God. So it can happen. And I'm learning that actually with the younger guys, as long as they're not primary, the HCG seems to be the super important hormone. It's not actually the testosterone that's that important. You need it as a baseline, and it's part and parcel of an optimized TRT protocol. But it seems that even the minimal dose of 100 units of HCG every day has a profound effect on your intratesticular production of testosterone and estrogen. So it's an evolving field, this TRT business. So, you need to understand the intricacies, and you need to be able to adapt and have a logical and methodical approach to how you address potential issues. So you need to have an understanding of physiology. You need to have an understanding of genetics, requirements, and how all the different parameters merge, or how one parameter sent out of whack can affect all the other ones. It's much like the argument of ignoring one hormone and optimizing another hormone. Now, again, the numpties say that you need to optimize every single hormone and treat every single hormone as independent and not dependent. You need to have a true appreciation of the fact that actually it's dependency that's important, whether it be direct or indirect. That's the important factor. So it can be weeks, it can be months, it can be years. The guys I have trouble with are the guys that come to me from a different provider, and they come to me from different medical clinics. They're the only guys I really struggle with, because they're normally placed on aggressive protocols. They're already placed on Testosterone, which is my pet hate, which has a physiological reaction with the SHBG, etc. And RG. It's just so yeah, we adopt a logical and methodical approach to testosterone replacement therapy. You need to understand that it isn't a matter of, there you go, buddy, you'll be golden on 125 of Testosterone every 5 days. It's a work in progress. It's always work in progress. There is no destination. Once you're optimized, you need to keep an eye on all of your symptoms and signs and act accordingly. There's a reason why we follow you up. It's because your protocol, when you're optimized, at one particular point in time, will not necessarily be your protocol in 6 months' time. Because obviously your physiology changes. Say you lose weight, or you gain weight, or gain muscle, lose muscle. There are all sorts of different parameters and variables that you have to take into consideration on reviewing somebody when they come and hopefully see you face to face for a TRT consultation. I can glean so much information from seeing my guys that you would not gain over the telephone or a Skype conversation. My guys appreciate the fact that whilst it might seem like I'm being a bit of a badass in making them come down, it's for a reason. We will always provide safe and effective care, and we will always do it with the best interest of the patient at our heart. Logistically, the international patients and the people that live in Scotland and really far away from the clinic, we do make some sort of leeway with them, and we do some Skype consultations, but I do insist on a yearly face-to-face. I don't care what's going on, you will come and see me. because I can't do my job effectively and safely without seeing you. So, realistic expectations. It's hard to have realistic expectations because you are sold a lie. You are sold all sorts of crap from unscrupulous people, and you need to realize that the primary purpose behind testosterone replacement therapy is restoring your male androgen levels so that you can take that next step forwards. You can be the person that you want to be. Now, optimizing male androgen levels is only part of that. You know, there are so many facets to health that you need to address, and hopefully testosterone will allow you to do that. But you can't see it as the magic bullet. You can't see it as this cure. It's not a cure. It can be a cure. You know, I've witnessed some incredible transformations, and people said I haven't changed anything apart from I've just optimized my male androgen levels. But you can't make that assumption. You have to appreciate that even with the best male androgen levels in the world, you need to do it. You need to take that step forwards. You need to understand and appreciate that whilst it might seem very simple from the perspective that you're replacing testosterone and replacing HCG, which does sound very simple, and there's a dosage, but you know, there's a massive difference between 100 milligrams a week weekly and 100 milligrams split between 50 and 50 twice a week, and there's a massive difference between 100 and 125. So it isn't a simple process. It is a complicated field that you need to see somebody that has your best interests at heart. Sometimes the path of least resistance, almost always the path of least resistance will not bring about the qualitative improvements that you seek, because you need to work. Life is about work, you know. You cannot ever rest on your laurels. You cannot ever think, I'm here, because the end point of life is death. That's the destination. So you need to appreciate the journey. You need to kick ass. So I think I've been chewing too much on my left side. Hold on, that's better. Yeah, so listen. Understand that your journey is your journey. Understand that it isn't easy. However, as long as we continue to make positive steps, then take some assurance that I will get you there.